I met a woman up near the border in Guinea, and she had this fascinating, I mean, to me it was this such a compelling story. Her parents had gotten sick, her uncle had gotten sick, nephews, her brother, everyone had died except for her and her brother. Hi, I'm Kayla Ruble. I'm a reporter and editor with Vice News. I've been covering the Ebola outbreak in West Africa for the past year, and I'm looking forward to taking your questions today. What do we got?
Hey, Kayla, thanks for coming on the line. We've got a bunch of callers lined up for you. The first person that I'd like for you to speak with is Dr. Ben Newman, who's calling us on Skype.
Hi.
Hey,
nice
Ben.
To show. So, I have a couple questions. I'm a scientist, and so I only see things when they appear in journals. And I hear that you've actually been out there on the ground. So my first question is that I heard that this Ebola outbreak was driven as much as anything by people's attitudes, by the way they behaved and reacted to the virus. The question is, have you got a sense of whether anything has changed with people's attitudes now that the crisis seems to be on the way out?
Great question, and it's funny to be on the other side with you. Ben's a virologist in the UK. He's been talking to me for the last year about the science of Ebola, because the context to understand this outbreak, it was really important to understand how the disease worked itself. And so he's really always been explaining the biological scientific aspect, and now I guess we get to talk about my expertise, the human aspect. So you're right, yeah. I mean, as we've been hearing the common narrative since last year, is that the Ebola outbreak was driven by a disbelief in the virus, and that it was driven by people not wanting outsiders into their community to tell them how to handle this virus that they didn't believe was real. And that really sort of peaked in August and September when you start to see the chaotic scenes from Monrovia, in Liberia, people lying on the streets. And at this point, the government really took action. If you talk to the Ministry of Health in June, there was sort of a chaotic chicken with their head cut off kind of feeling. But I think by July and August, they really got things organized and they got this Ebola is Real campaign going. And even now, a year on from the outbreak in March when I was in Liberia, it's hard to go 10 feet driving without seeing a sign, huge billboard saying Ebola is real. You look on the side of the street, there's someone wearing a t-shirt that says Ebola is real. I think every interview I did, whether I asked or not, in a question and answer, someone would say, Ebola is real, we know it's real. Even out in the middle of a rubber plantation in the middle of nowhere, someone would be telling me scientific facts about Ebola and the 21-day incubation period to the point that they know way more than any of my friends here do about the disease, which is great to hear. And I think, when you look at the disbelief in the beginning, there's a lot of cultural context and country context in all three of these countries, stricken by war and corruption in their governments and disbelief. And also to think that someone is coming in and telling you in a spacesuit up near the border of Guinea that there's this hemorrhagic fever when you have never learned about it before. It's never been in your town before. And they're telling you it's coming from the bats you've been eating for 100 years. So how are you supposed to believe that? But I think by the government and the local community leaders going out into the community and talking to people one-on-one and explaining to them, not just, hey, this virus is here, but here's the science of the virus. Here's how it works. Here's how you prevent it. Here's what it is. And they talk in terms that their community members understand in a way that you or I could not do that. And watching that firsthand, it was so obvious that it needed to come from the local leaders. And I think people started to sort of understand this education. And then at the point of August and September, you have to realize that almost, especially in Monrovia, it's like being in New York City or being in London and seeing an ambulance go by every 5 minutes and knowing an Ebola patient is probably in that ambulance. And looking outside of your house and seeing a body bag on the street and knowing that person died of Ebola, you could hardly avoid it. So at that point, when people are faced with dead bodies in the street, there's almost no way to deny it at that point. And so thanks for your question. That's great. And do you have anything else?
Yeah. So in your opinion, is this Ebola is Real campaign the thing that made us turn the corner, the thing that actually stopped Ebola?
Right. I mean, I think that was a huge aspect. There's sort of these two narratives of what the local what I can speak firsthand of what I saw in Liberia, but I think in the other countries as well, what the local efforts were, what the government efforts were, and then what the international efforts were. And something we see starting at the end of 2014 is the U.S. Army and governments and aid organizations all of a sudden getting this influx of funding finally, 6 months after the outbreak started, and they were building these emergency treatment units. Well, most of those went unused. By the time that money came in, the outbreak had already started to stem. It had already started to slow. And when you look at why that happened, it's a direct result of the government finally just buckling down and getting into these communities, and at the same time, the community responses in themselves. You start to see, when you start talking to people and you spend some time there, you see some really unique ways in which communities tackled the virus specific to their community, specific to their people, in a way that it might not have worked for the village next door. They're actually starting to study that, why some villages saw Ebola and why some didn't. And something I saw while I was up in Lofa County, which is near the border with Guinea, that's where the disease first showed up in Guinea, and it crossed over the border last spring. And so these villages were really caught off guard. All of a sudden, they're hearing of this Ebola virus they've never heard of, as we talked about before. And so I went to this village, and it was about an hour away from the closest city. And there were had two tribal leaders, Mandingo and Loma, which are rival tribes. And they started to hear about Ebola, and their community didn't believe it. They didn't really believe it. They kept outsiders from coming in to talk to them about this disease. But then they were compelled to come into a city and go to a seminar, a kind of a training session. And some medical experts, local Liberians, walked them through, here's what this disease is, here's what it does, here's how you prevent it. And the way the chiefs told me, once they learned about it, they realized this is serious. This is going to hurt our people, and we have to do something to prevent that. And they tell this story, it's sort of ominous. They drive back into the town on this, one-lane dirt road, and there's only one way in and out of this town, and it's on the border with Guinea. And as they got to the kind of entrance where there's a gate that's seldom used because it's a town of 1,500 people, they closed the gate on their way in, and they said to everyone, we are the last people coming in. No one is allowed in and no one is allowed out. That was around August. And it was hard for them. They had to keep family members out. They wouldn't let anyone in. It didn't matter. They didn't have the ability to check your temperature or check to see if you had Ebola. They had to keep you out. And fast forward 6 months later, that village never got a case of Ebola. So it really did work. And if you compare it directly to their family village across the border in Guinea, which was really resistant to efforts, community efforts and aid worker efforts, I think about 30 to 40 people, they said, died in that village because they wouldn't let assistance in. So you can really see how community efforts were so important. So yeah, great. Thank you so much, Ben.
Yeah, it's fascinating. Thank you.
Thank you.
All right. So thanks for coming on, Ben. Kayla, I've got a tweet I want you to take a look at.
Awesome.
Kaylee sent us this tweet, and she wants to know if you think the outbreak in West Africa has negatively impacted public opinion about the region as a whole. What's your thought about that?
Right, so, that's an interesting question. I think what we saw, especially early on, was if this outbreak showed us anything, it was how unaware people are of West Africa, of the region, of the continent as a whole, and of the virus itself. So what we saw in especially September, August, when people really started to get scared in the US and in the Western world, and all of a sudden you were seeing calls to cut off flights from East Africa, where there was this map that this graphic that went sort of viral, I think, where it showed that the distance from London to Monrovia was much closer than, say, Nairobi in Kenya to Monrovia in Liberia, and seeing that distance. So it was sort of this mass fear you saw as people canceling safaris in other parts of the continent. So I think if anything, we just saw that people really didn't have a concept of West Africa and what that region is like and what was going on in these countries. And that, I think, then impacted our response because we didn't look at this as a human story. We cut off flights as if we were cutting off flights to it like for a trade route, when really we were cutting off ways for doctors and aid supplies and everything to get into the country. And I just don't think we were looking at the human element. At the same time, I think now what people didn't know about this region, all they know is Ebola. So of course you hear lots of jokes about Ebola in the last, on social media and whatnot. And then at the same time, my friends, as I was in Liberia, we were emailing about beach plans for the summer. And that's like 4 months away at this point. There wasn't a single case of Ebola while I was there. I was working on the recovery effort. And they're making jokes about making sure I don't bring Ebola to the beach. So there's just such a misconception of what this disease is and what was going on, and lack of awareness. So I think that's sort of the more telling aspect of this and what the public opinion is of West Africa. So great, awesome question. What's next?
Hey, so next we've got Osman, who is calling us from Washington, D.C. So
okay.
Let's say hey to Ozzy.
How's it going?
Osman, can you hear us right now? Okay, let's see if we can get Ozzy fixed, and we'll come back to him later. In the
Oh,
meantime...
I'm good now.
Okay. Well,
Glad you joined us.
Yeah.
Yeah, my computer froze. I'm sorry.
That's all right.
Anyways, I want to thank you for all the work that you've done first,
Thank you.
and keeping everybody informed. I'm wondering, when I think it was, like you mentioned earlier in August, when things started to kind of spiral out of control, and the international community kind of started to wake up. I mean, I think in the last 10 months alone, there have been 10,000 reported cases of Ebola in Liberia, just Liberia, something like that.
Right.
And I wanted to know, with that kind of influx and those kinds of numbers coming into hospitals that, I mean, at least from the looks of it, never really seemed prepared to deal with such an outbreak. How many, did you encounter unnamed bodies, or people who, who families never came to get them, or people who were just never ever identified? And could that, do you think it was enough to make all the estimates of that 10,000 kind of, lowballing the estimates, I guess is what I'm trying to say.
Okay.
Does that make sense?
Yeah, that totally makes sense. That's a great question, and it is a really important one when you're looking at a disease outbreak in general, not just Ebola. So to address your last question, I didn't come across any unnamed bodies. I know, especially in the early parts of the outbreak, and even throughout, when you were having to change cultural practices for burials, there were families that were burying their loved ones at night, whether they had Ebola or not, because they didn't want to give up that practice of, some of the traditional burial procedures and have their loved ones cremated. So of course, there were probably some of those cases. And it's hard to say, it's hard to estimate that. I didn't come across any specifically. I've heard of roadside graves, where someone was dying on the way, and it's hard to know whether they got, whether they were accounted for. But something that's interesting is that you're right, the public healthcare system was totally overwhelmed by this disease, as was record keeping. I mean, when you walk into these treatment centers or these hospitals or these clinics, there's not computers there that keep, medical records. So that was a problem, keeping track of things, right? But this isn't the first time we've seen this. If you actually look back in the early 1900s, starting at the Spanish flu outbreak, if you were to Google that right now, you would see disparities of tens of thousands in the amount of people that they think had, whether they were infected or died of the Spanish flu, because the public healthcare system at the time was so overwhelmed. Doctors had to do everything they could to make sure they were treating people. They didn't have time to keep tabs. And this tends to happen in outbreaks, especially then fast forward to now when you're in a place like Liberia, Sierra Leone, or Guinea, where there aren't medical records and whatnot, and these healthcare systems were caught off guard by this disease. So, of course, I would say it's hard to know how accurate the numbers are, and if we'll ever have a fully accurate number. I do think the government's worked really, really hard to count anyone that even had remote symptoms, because another issue here was that we didn't have the ability to test these patients. So if you came in July and had a fever and anything similar to Ebola, you were at least counted as probable, suspected, or confirmed. Confirmed, you had to get a test. That could take days. You had to go to the lab. We had to bring in equipment from the US. We didn't have those capabilities. So I think, if anything, in some cases, maybe there's overcounting. Who knows? Someone might have had malaria and was counted as that. I think a lot of the samples have been saved, and they are trying to kind of backtrack and go through some of these samples and try to reconfirm. But yeah, we might not ever have a perfect estimate. The important estimate is knowing when we get to zero. So that'll be the more important one going forward. So thank you so much. And you have another question?
Yeah, actually, I guess it's a follow-up to this. It's just, it seems like then because these hospitals weren't prepared, aid organizations and people would come in and they would have to kind of build the groundwork, the foundation, both administrative and technological. So I guess now my question is, what is happening to the hospitals to help them prevent outbreaks in general, and not just Ebola? What going forward, what kind of changes are being made to the actual healthcare system in these countries?
Right, so that was something I was really paying attention to when I was there, and was really interested in, was how are we going to make sure that this doesn't happen again, that this virus never spirals out of control in these countries, and hopefully other countries as well. So I went to a lot of clinics, I went to a lot of hospitals. to see what they were doing. And I think on the local level, they've installed triage centers. So now you walk into this little clinic, which is the size of probably your living room, and there's going to be an aspect of it sitting outside where you have to go first, and that's where you get your temperature. And they make sure that you don't have any symptoms for Ebola. And if so, there's a bed that they can put you in while they wait for someone to come pick you up. So those kind of measures. And then you see some aid groups are investing in hospitals throughout the country to better prepare them to make sure that they're implementing infectious disease measures, not just for Ebola, but making sure before the outbreak you would have seen 6 babies in one bed after they were born. Well, that's not great if one of these babies gets a flu, so they're trying to sort of minimize that. They're remodeling hospitals. Redemption Hospital, which is one of the biggest public hospitals in the country, and also was sort of an epicenter for the outbreak in Monrovia, there's a ton of renovations going on there by International Rescue Committee to make sure that they can get 24-hour electricity. That's an issue, right? Make sure they have water all the time. So I think there is a lot of investment going on. I don't think there's enough. I think right now there's still this focus on the outbreak, and we have these empty ETUs sitting around. So hopefully people will sort of shift into investing into this totally devastated public health system, because that's going to be a real issue going forward if we don't fix that. And whether it's Ebola or whether it's malaria, which is coming soon because it's the rainy season, it's going to be something. So it's a really important thing to work on. So thank you. And then do you have anything else?
I guess my last question to you then would be, like, I'm sure you saw a lot of things, and it's hard to kind of reflect on trauma as it happens, and those kind of moments are when you finally hit your bed and you're closing your eyes and you're trying to get to sleep. Things start to come back, things that were suppressed. What kind of stuck with you that, lingered, that you saw, or any stories, anything?
Yeah, so I think it was 2 things. I mean, one was just the sheer amount of death people saw. You're talking to people who I met a woman who lost 37 family members, and that's not 37 family members over years and years or through a war or where you're seeing them die. It's within 7 days, and you yourself might have been sick in a hospital, so you woke up from the disease and all of a sudden 37 family members were gone. And maybe you all live in the same sort of homestead, so now your home is empty. I mean, that to me is unfathomable, to lose that many, to have that significant loss of life in such a short time period, especially for a country like Liberia and Sierra Leone and Guinea, who have all gone through years of civil war. So to imagine that on top of that, and that sort of disappearance of people, and that changed your whole life. It goes from living with tons of people to living with no one. So I mean, how do you deal with that? That really stuck with me. The other thing that really impacted me and was something I didn't even expect to see when I got there. When I was on my way, this was not on my mind as a story I was looking into, were the widows that I met. Ebola has always been thought to be a sort of male disease, or a female disease, that women are the most affected because they're caretakers, because they work in hospitals as nurses. And you can only get Ebola through direct contact with bodily fluids. So that's taking care of a loved one or taking care of a patient is when you're most likely to get it. This outbreak was not picky. It was not selective. Whether it was men who were burial workers, men in the mosques participating in traditional burial practices, top surgeons in the country, almost just as many men died as women, or died and were infected as women. And it's sort of 50-50 in all 3 countries, which is new. We've never seen that before. So as I was, traveling through the country, I just noticed I was meeting so many women who had lost their husbands. And I met a woman up near the border in Guinea, and she had this to me it was such a compelling story. Her parents had gotten sick, her uncle had gotten sick, nephews, her brother, everyone had died except for her and her brother. Her husband had died, actually. She woke up in the treatment center and was told, everyone in your family except for your brother is dead. And I mean, she was devastated. Not only did she lose her life partner, she lost the person who who helps her financially. So I sat with her on the side of the road as she's selling like odds and ends and baking soda and whatnot, and she's wondering how she's gonna make ends meet, and how she's gonna get by. And she just, you can see like the pain in her eyes, and it's really hard to watch. But also, at the same time, it gave me sort of I was a bit optimistic after talking to her. She had her, I think, 9-month-old son on her hip, and she was telling me that when she got sick, she was taken on a motorbike an hour away to a hospital, and she took her baby with her, because at that point, there was no family to take care of the baby. They were all sick. And she got to the hospital, and she doesn't remember a lot of it, but the baby stayed with her the entire time by her side. They tried to take the baby at one point, but he got kind of sick and cranky, so they gave him back. He breastfed the entire time and somehow was never infected with Ebola. So that's sort of, he beat the odds, and there's research that needs to be done into why that happened. But I don't know, it kind of makes you feel optimistic when you then see her now, as hard as her life is going to be, and as much as it feels like there's no one there to support her, including the government, including international aid organizations, she's got this baby who somehow survived this disease, and there's sort of that future hope, I guess, or optimism. So yeah, thank you.
Thank you. Thank you.
All right, Ozzy, thank you for coming on the show today. So Kayla, another person I want you to say hey to on Skype. Let's say hey to Alexis, who's calling us from North Carolina.
Oh, great. Hi, Alexis.
Hey, how are you doing?
I'm good, thanks. Thanks for coming on.
Thank you so much. Okay, so I'm going to come on the mental health side of this, being an art therapist, and it tags along to exactly what you were talking about. So how do you think this epidemic has impacted the mental health of an already post-war trauma country and region? And what were the observations that you made?
Right, so I mean, the trauma is real. I mean, everyone, as I mentioned earlier, everyone saw a dead body or was affected in some way, or knows someone who is infected, or saw an ambulance driving by, and just that stress. I mean, that's what's so interesting to me, is how the trauma, we understand the trauma of war. I mean, we don't necessarily understand it well, but we can see that. You can see bullets, you can see that. You can't see Ebola, you don't know when it's coming. So not only to lose someone to that, but the stress, I guess, of living with that, of living with having to wash your hands. Did I wash my hands? What did I sit on? Who did I touch? That sort of just general trauma. And then just again, as I said, the massive loss of life and the way that's affected people and the way that's going to change their lives for the next 30, 40 years. We have a lot of young survivors. And the survivor issue is really important, and seeing what the survivors are dealing with their trauma. I think that to me is one of the most neglected issues right now, is both the mental health and physical effects of Ebola. We, up until now, the largest outbreak would maybe affect 300, 400 people in Uganda and Congo. There's been about 26 outbreaks in total. And we've never really, there's been mortality rates of upwards of 80%. So we've had maybe a dozen survivors of certain outbreaks. Right now we're gonna have thousands in each country. And so we don't have a lot of research to look back on to understand what happens when someone survives Ebola. Well, we're starting to see it now. And one of the things we're starting to see is these survivors there's probably like 4 main things that I kind of saw as a trend, and when I talked to MSF, for example, that they're really seeing as a trend. And they actually colloquially call this the post-Ebola syndrome. And so what we're seeing is the main thing is joint pain, really severe joint pain, to the point when someone is describing this to you, they tell you they really can't put it into words. It's like no pain they've ever felt before. And they're getting pain medicine for it, but it's constant. So that was something. The other thing is loss of vision, sort of how where they're not really sure whether it was like the high fever or some other effect of the disease, medicine, chlorine, whatever. But a lot of people have seen their vision worsen. And then on the psychological end, which kind of interlaps with the physical, you see flashbacks. Flashbacks was something everyone talked to me about, and it might occur to them when they're sitting at home and they think about the spouse that they lost. And the way it was described to me by a survivor named Oliver was as sort of almost an out-of-body experience. He sort of flashes back to this point when he was in the hospital. He had started to recover. They thought he was getting better, but all of a sudden he sort of took a turn for the worse. And the way he describes it is the virus was trying to leave my body, but the only place it could go was my head. And it made him sort of crazy. It made him act out, the way he describes it. And he was throwing things, and he was messing with doctors and nurses and kind of terrorizing the patients and unplugging things. And he can kind of see himself doing it, and he knows that's not how he is, but he can see he's doing it, and he flashes back to this. And in that flashback, interestingly, they tend sometimes to get headaches, which then kind of connects the physical. And on the same sort of the converse, when they get this joint pain, it's really reminiscent of Ebola symptoms. So sometimes they get this feeling that they might have Ebola again, and they take themselves to the hospital. So the way in which this is all interconnected is, I think, something that's, I can't say unprecedented, but really something we haven't seen often, and we're going to have a lot to learn about it, and hopefully it's something people start to pay attention to as we kind of shift gears from emergency response to what do we do now. So yeah, really important.
And actually what you just described is trauma response. It's a PTSD, how going back to those symptoms and those nightmares and actually reliving it. And it goes into my next question. And I've been lucky to be able to actually experience this in my organization, Playing to Live, where we're engaging with survivors, females and children, in an expressive therapy way for them to start to heal. And what we're getting is resiliency, and what we're seeing is resiliency. And so that's what I want to hear from you is, so you've experienced all of this trauma yourself, and in the country, and seeing all this, but Liberia has so much resiliency. And so I'd love to hear what your observation was.
Yeah, I think that was one of my most important takeaways, and quite unexpected. I mean, I've been covering this for a year, but a lot of it I was watching from New York. I was seeing the videos of chaos in the streets, pouring rain, bodies everywhere, and that was such a bad time period. So I know I was thinking, when I got off that plane, I didn't know if I was going to walk into sort of what I was walking into. Were people going to want to talk? Were people going to be was there going to be some sort of depressive feeling? And it was quite the opposite. I'm told that the streets aren't as lively as they used to be, but to me, those streets were really lively, and people were, I think everyone I went up and talked to was so happy to talk to me, whether it was about Ebola or whatever else they wanted to tell me about. And I think they were so accepting, and they were so proud of what they've done as a country. I think that they've come together and they really have worked through this disease, and they feel like whether or not they might have been neglected in the beginning, that they've beaten this, or they're on their way to beating it. And I think that resiliency is one of the most obvious things when you get to Liberia, and seeing just how people have overcome this. And I think it's a model to look after for other outbreaks and other issues, and maybe something interesting to study. So we'll see. But great. Thank you.
Yeah, thank you so much. Thanks for saying that.
Of course. Thank you. What's next, Michael?
Kayla, so we have a tweet that I want you to take a look at.
Okay.
So this is from Kayla Faye Saunders, fan of the show from New Zealand. She wants to know how we can keep Western media interested or even aware that tragedies like Ebola are happening if it's not affecting people in the West. What's your thought about that?
Yeah, so that's a tough one. I think, I wrote my first story about Ebola in March when WHO made the announcement, and I think that was in March, and I think it didn't really start making major headlines, at least locally in the US, until about August. Of course, it was reported before, but that panic took a few months to set in. So I think that's a really important question we need to ask ourselves as journalists, how we get people to pay attention to something that is important, that does have a global effect, without sort of sensationalizing it. And I think the way we do that is just continue to cover it. We can't publish every story here at Vice News, but we made a choice pretty early on in this outbreak that we were going to dedicate resources to cover this outbreak. We had a story as often as we could, and I think we sent 2 teams on the ground really early on, later in the fall, and then I was there in March. So I think by keeping people on the ground to get the human element and to understand what was going on and to get that context and to be able to show that to people, regardless of how dangerous it was in the fall when we were there, or maybe the recovery efforts now, we just sort of kept going, and we're going to continue going. I think that's all you can do, and hopefully by giving a human connection, it can sort of help Western audiences connect. But you can't push it, but I think it's just keeping it on the front page, keeping it in a place where it's accessible to the average reader.
Cool. So
awesome.
That's a good answer to an important question.
Yeah.
Kayla, you made it all the way to the end of the show. How
Excellent.
Do you feel?
Oh, I feel great.
So why don't you say goodbye to everybody watching?
All right, thanks so much. It was really fun. We'll see you guys next week.
In most of Monrovia, life moved along as normal as it could. It wasn't a zombie land. People all still went about their daily lives, with some added precautions put in place. The city was undergoing a heavy-duty awareness campaign, and most Liberian rappers had even recorded songs warning people to be careful.